Is there any role that if you were designing an organization that you would encourage folks to think about making sure they have or adding as we look to some of the goals that folks are trying to accomplish?
Was this one of the questions?
No, this is...
I think that these are unicorns, but I think that it is incredibly helpful when you have a clinician who also understands data. And I think some of the challenges that organizations face is they have the clinicians who understand how things are supposed to be done, or they understand, what has to be done from a patient care perspective. And then there are those people who are IT, understand from a back end perspective what that looks like. And oftentimes the challenge is getting those two sets of folks to agree or to come to understanding. And so I think the clients who do really well have someone, whether it's a nurse informaticist, pharmacist informaticist, a physician who really understands not just the care requirements, but also the data requirements and what happens with that data in the EMR.
Wow. So unicorn. Do you have any advice for any clinicians out there who are looking to understand data more or to really be more effective in their work based on what you just recommended?
I think the key to clinicians, I was gonna say get down in the weeds, but here's the other thing that's is just challenging for them is that so often they don't own or store their own data. And so getting into the back end and seeing that when you click this button, this data point is generated is just really challenging for them.
Yeah. Picking up on what you just said, it sounds as if you're saying clinicians need to advocate for data and analytics around the key things that they're working on from a patient care perspective, so that they can, when they're working with the patients or working with the clinical teams, they have the data right there accessible that matches their workflow or their specialty, or they have the data point that they can use to bring into that conversation.
Well, here's the thing. I know from my wife's work at Maine Med that they have their KPIs, they have their boards of these are the metrics that we're looking at internally. And so for larger organizations, I think they certainly have those KPIs, they have those metrics that they are looking at. And I think I don't know whether the clinicians who are looking at that actually understand the data, or they're just looking at the raw numbers. We did this many of X out of this many events. But part of, if you really want to get down into the weeds of it, understanding that data, how did you get to that number that's on your KPI board? And maybe that's, spending some time with your IS team and your data teams, and, how are they actually capturing this? And does it match what you are doing as a clinician in your day-to-day practice?